ladies and gentlemen, several of you sent me this story, and I just want to say thank you to each and every one of you. Now, HIV in rural America actually has been going on for quite some time, and it's due to the opioid addiction that's going on, and a lot of people having unprotected sex, people having sex for drugs. Those kind of things are going on. So, you know, are they ready? Probably not, because remember that those areas that are rural are a lot of it is considered depressed areas in the country because it's mainly a lot of old people, a small population of young people, and it's not really growing there because the few jobs they do have are very low paying. Even for nurses and doctors, those jobs are very low paying. And if you've been following me, especially on the opioid videos that I've done in the past, you would have known that rural America has been struggling probably more than any other location in the country when it comes down to drug addiction and HIV and STDs and all the stuff that's spreading from that drug addiction. So HIV is coming to rural America. Hmm. While there are still about 1 million people living with HIV in the United States and some of America's largest cities, the news about HIV and AIDS is surprisingly positive. New HIV diagnoses fall to historic lows. The New York City Department of Health announced November 22nd, reporting that the largest city in the United States had fewer new diagnoses of HIV in 2018 than during any year since statistics were first kept in 2001. This was just a few weeks after Philadelphia's Department of Public Health reported a 14% drop in the number of newly diagnosed HIV infections overall, and a drop of more than 1/3 among Black men who have sex with men, and especially vulnerable population. San Francisco and Chicago have also seen their rates of new HIV infections falling. But while robust municipal health campaigns are creating downward HIV trends in some of America's largest cities, in much of rural America, an opposite trend is emerging. There have been, of course, always been cases of HIV in sparsely populated parts of the country, but in these places far from cities, the condition that leads to HIV transmission are now intensifying, and rural America is not ready for the coming crisis. Indeed, in Appalachian, West Virginia, the crisis has already arrived. A cluster of 80 new HIV infections have been diagnosed since early last year in Cabell County. As A. Tony Young, an AIDS activist, puts it, the epidemic of opioid addiction fueled by drug companies' promotion of pain medication beginning in the 1990s is a crisis for rural regions, in part because these regions are completely unprepared to deal with the magnitude of the problem. Miss Young founded what is now called the Community Education Group in Washington, D.C. in 1993, originally to address HIV and AIDS in women. An African American lesbian has She has spent most of the past 30 years working to help members of the Black, gay, and urban communities affected. But since her recent move to West Virginia, near the Appalachian coal fields, she has seen the crisis take a different shape. Unlike large urban areas that have dealt with similar health and substance crises in the past, and that have networks of service providers and consumers in places, small rural health jurisdictions often lack infrastructure to confront the crisis and have little history of dealing with comparable health issues, she explained. And it's quite a crisis between 2006 and 2016. The Charleston Gazette Mail reported nearly 21 million opioid pills were sent to a single West Virginia town of 2,900 people. For years, according to the Center for Disease Control and Prevention, West Virginia had the highest rate of drug overdose deaths of any state in the country. By 2017, in Jefferson County, 1 in 4 people had a controlled substance prescription. And when prescription highs can't be sustained, people often turn to using and sharing needles to inject heroin and then fentanyl, leading to hepatitis C and HIV. This avoidable crisis has been exacerbated by unemployment, declining coal mine production, and economic pressures on regional press to act as effectively as a watchdog. At the same time, healthcare is relatively inaccessible. It's not so easy to get to the nearest town to see a doctor. Judith Feinberg, professor of medicine at West Virginia University, explained, pointing to a lack of transportation and stigma as the biggest barriers to testing and care. People living with HIV are stigmatized everywhere, and those who live in large cities can get tested while feeling relatively anonymous in a clinic in ways rural dwellers cannot. What's happening in West Virginia should not be a surprise. After a hepatitis C and HIV outbreak in Scott County in Indiana in 2014 and 2015, that was fueled by deindustrialization and opioids. The CDC released a list of 220 counties similar, vulnerable to such outbreaks among people who use intravenous drugs. The densest concentration of those counties is along the Appalachian Trail, with 28 of them in West Virginia, more than half of the state's 55 counties. There is no way that doesn't wind up as a HIV outbreak in the state. Ms. Young says, yet unlike in places like New York, with its comprehensive sex education, efforts at queer and trans-specific health, public health, embrace of public syringe exchanges, and what is Health Commissioner Oxyris Borbat describes as a sex-positive approach when it comes to confronting its HIV epidemic. Rural America is ill-repaired at best and antagonistic at worst. For example, despite research showing that syringe programs are effective at limited transmission of HIV and encouraging people to enter drug treatment, 2 cities in West Virginia, Clarksboro and Charleston, have recently moved close or limit their needle exchange programs. Negative press, business worries, and conservative approaches are among the reason the program have been reduced when they urgently needed to be expanded with statewide testing and education about preventive HIV medication. Well, ladies and gentlemen, it's really hard getting people in treatment. I know these articles will say this, but that's easier said than done. A lot of these drug addicts don't want help. They don't want rehab. They just want to do their drugs and be left alone. So that in itself, and that's not hard to see why that's part of the reason why the opioid plague has gone on as long as it has. You got a lot of people out here, they don't want you to intervene. They want to do their drugs. I've seen such tragic, avoidable public health policies unfold in a suburban setting in my own research in America's heartland. Since 2014, I have been reporting and researching in St. Charles County, Missouri, a white flight suburb to the west of St. Louis, where the local prosecuting attorney charged Michael L. Johnson with multiple felonies for transmitting HIV. Mr. Johnson conviction was overturned on appeal in 2016. Even though criminalizing HIV is not effective in decreasing rates of HIV, one of the reasons the county wanted to prosecute and imprison Mr. Johnson was likely to prevent him from transmitting the virus to others in order to protect the public health. Yet, in 2017, St. Charles County closed its only clinic for sexually transmitted infections, which provided nearly 1,000 exams a year, with fewer people getting tested and with fewer people living with the virus, taking medication. That can prevent transmission to others. More people in this area could become HIV positive. While it's true that people who are Black, queer, transgender, homeless, incarcerated, or poor, or who use injection drugs, are disproportionately affected by HIV and AIDS, the misguided impression that members of these groups are the only ones affected has unfortunately contributed to the media's choice to deprioritize coverage of HIV and AIDS in recent years. Meanwhile, the rural, heterosexual white Americans who have been the subject of countless national profiles because their image correctly to represent all of President Trump's supporters are more likely at risk all the time. But while we're bombarded with analysis of many aspects of their plight, we don't hear about this crisis facing them. It is time for that to change and for policymakers to address the root condition that allow HIV and AIDS to flourish in rural communities. In West Virginia, this includes increasing access to health care, supporting all workers hurt by deindustrialization, and undoing the stigma tied to sex and drug use. These changes will, of course, provide much needed help for the people in urban cities where HIV rates are dropping as well. But the new major terrain of this crisis right now is in rural America, and it can't be ignored any longer. Well, ladies and gentlemen, like I said, I read about Indiana probably 2 years ago, when HIV was going through the roof there, and it was because so many people were sharing needles. So the fact that this is spreading to other rural communities across the country, I'm not surprised, you know, and it is going to be tough on them because, I did stories on hospital closures, and there's a doctor shortage in rural America, and it's getting harder and harder for these people to get health care locally. Many of them have to travel further away even for care. And like I said before, they don't pay well, not even doctors in rural America. That's why so many of them go to the cities for work in the suburbs, because the pay is just so much greater than what they will get in rural America. But drug addiction has always been a problem, and it is still a big problem in rural America. It's a huge problem. And it's all tied together. I mean, even the stories that I did on how many people are now going to jail in rural America than in urban America. Everything is shifting in this country, and that should be of no surprise. But y'all, please tell me what you think. This is pretty deep. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.